Colon cancer ranks as the third most common cancer in both men and women in the United States. It accounts for about 140,000 new cases annually and about 50,000 deaths. So it's a pretty serious condition, and it's one that I want to talk with you about today so that you can either reduce your chances or prevent getting this disorder, and certainly reduce your opportunity for the most downstream and most severe consequences, prolonged illness and death and the like. Well, what are the risk factors for colorectal cancer? Obesity is a risk factor. Inactivity. Eating diets high in processed meats and red meats like beef, pork, and lamb are risk factors. Smoking is a definite risk factor for colorectal cancer. Diabetes is as well, and heavy alcohol consumption is another risk factor for colorectal cancer. Unfortunately, if you have a personal history for Crohn's disease, ulcerative colitis, or a personal history for a prior colorectal cancer, you're at greater risk and require more precise surveillance than individuals who have normal risk factors. In any event, this YouTube video is about preventing or mitigating your risk for acquiring colorectal cancer. Well, what can you do? Well, first of all, pretty simple. No, reducing your weight is not pretty simple, but reducing your weight will certainly reduce your opportunity to get colorectal cancer. Exercise regularly, 30 minutes each session, most days per week. And that can be just a nice brisk walk, or it can include resistive exercises. It can be on a treadmill. Whatever you enjoy, exercise more regularly. Reduce your consumption of red meats, processed meats, and the like. For goodness sake, stop smoking. Stop smoking. If you smoke, you're going to get colorectal cancer, or you're more likely to get colorectal cancer. So stop it already. Limit your alcohol to no more than 2 alcoholic beverages or less daily. Most importantly, it's a good thing to get screened regularly. Fortunately, a new test called the FIT test, F-I-T test, fecal immunochemical test, is both accurate, it's specific, and it's a wonderful first step screening activity to screen out the likelihood that you have colorectal cancer. If, on the other hand, you have a positive FIT test, you're going to need to have a colonoscopy. Also, if you have the risk factors that we talked about, personal risk factors, Crohn's disease, ulcerative colitis, a personal history for colorectal cancer, you're going to need screening with a colonoscopy. So the positive FIT test, Crohn's, ulcerative colitis, a personal history, you're going to need to get colonoscopy on a regular basis, as indicated by your physician, nurse practitioner, and the like. Well, remember that colonoscopy is not without risk. It's possible to actually poke a hole in the colon or perforate the colon. That would be the most downside risk. But it also requires anesthesia, and that's in and of itself is a risk factor. Finally, if you're going to have a colonoscopy, and this is really important, follow the instructions to clean your colon carefully. If there's fecal material in the way of the colonoscope, they can't see what they're looking at. They need a nice clean colon to see every bit of it and get a good examination. This is Dr. Jim for Be Healthy, Be Happy. Power your path to happiness. Be screened for colon cancer regularly. And subscribe to Be Healthy, Be Happy with Dr. Jim on YouTube.